Good evening, Eva. Thank you so much for inviting me to this webinar. It's brilliant. I think these series are amazing. They're going to help so many people. So as a dental hygienist, I'm absolutely bats and crazy about oral hygiene. So it's really important for everybody to be mad about it too, but especially for patients who've been on that journey with oral cancer, because everybody's journey is different. Treatments are different. People's personalities, the psychology that goes with it. But the mouth care starts from before diagnosis, ideally, but for a lot of patients, it's not priority. So mouth care, whether it's a toothbrush, electric toothbrush, manual toothbrush, mouthwashes, gels, sprays, all sorts of things that can help patients. But it's a very individual journey, as you know yourself.
Well,
So
Josh, could you tell us what we should do first? I mean, typically when I go to clean my teeth before I go to bed, the first thing I do is floss. Is that what you recommend before
So the
brushing?
research, obviously, I want everybody to be cleaning between their teeth if they're able to reach, if their mouth is able to open wide enough to be able to get to those nooks and crannies of floss, or interdental brushes, whether they're little rubbery silicone ones or whether they're bottle brushes, more bristly type. All depends, really. It depends on the size gaps, whether you do it before or after. There's lots of different research out there. Some say to do it before, some say to do it after. For me personally, I don't mind when people are doing it as long as they're doing it, you know? So that's my
Okay,
point of
so
view.
so for those of you who are interested, I am a 26-year survivor and I use the rubber tipped interdental I use that rubber tip thing. I cannot believe after I brush and floss, I can still get some biofilm off on that rubber tip. Go figure. But as Josh said, it's so critical that we oral cancer survivors keep our hygiene as top notch as possible. And there are tricks like the oral irrigators, the water
Yeah.
irrigators. Is there a brand that you recommend?
There are huge numbers of these irrigators now. I think they've been in America for about 30 years, and in the UK probably about 20 years we started knowing about them. They're great for patients for all sorts of reasons. Those with obturators, possibly not. Those with implants, if they can reach them, absolutely. So as you know, depending on how much of the jaw or the maxilla, the upper jaw has been removed, depends on the actual ability to get to these nooks and crannies. I like water jets. The one thing I point out for most patients is when to use it. So use it before you brush, because if you don't, what you're doing is you're flushing away all that important fluoride and it's off down the sink. So use the irrigator first and then toothbrush afterwards. So that's the only tweak I would say for patients.
That's an excellent
Top
tip.
tip.
Excellent
A-
tip.
As for
Karen?
brands, I mean, there's lots of different ones out there. So the main one's been Waterpik Water Flosser. There's Philips. There's different brands. There's even really
Okay.
cheap ones that you can buy for like £15 on the online, or £100, depends what you prefer. But also the main thing is to look at is if you've actually got electricity at an electric point in your bathroom. So if you haven't, maybe you need to charge it up in your bedroom or a spare room and then actually use it once you get into the bathroom. So it depends if you
So,
got that, depends then how much sort of water pressure you have. They do
and
vary.
Karen asked about the toothbrush. I use, there are two toothbrushes that I really like. I like Nimbus and Curaden or Curaprox, which is a
Yeah.
Swiss company, I believe. And what I like about those two brushes is that I can clean my tongue and my gums as well as my teeth with the one brush. There are a lot of brushes. The brushes I get when I go to the dentist and they put a little brush in the goodie bag to send me home with, those brushes are too harsh for me.
Mm.
And even if you go to the drugstore and you buy a soft toothbrush, I find that it's not soft enough. So, Karen, people starting out right after surgery really
Mm.
need to be careful with their oral tissue. Is there a brush that you recommend, Joss?
So for soft brushes, Sakura Brox, that is definitely near the top of my list. There's a whole range of special care brushes. So TP have a special care brush.
Right.
Curaprox do a surgical brush. They also do a really a lovely soft brush. So with Curaprox, with toothbrushes, most toothbrushes have 600 to 800 bristles on them. The Curaprox brushes can have 1,460. They can go up to 12,000, go up to even more. So the higher the number, the softer the actual toothbrush head is.
Mm,
Sometimes I recommend to run it under a hot tap before you use it, and that can make the bristles a little bit softer. The brush might not last so long, different things can help like that. There's oh gosh, what's the other brush? Now, there was a brush, my dad had Parkinson's, and there was a brush that he liked, which had three sides to it. The Collis
oh,
Curve brush. So that's a lovely brush. There's a whole plethora of brushes out there, but definitely special care brushes, especially after surgery. You may not even be able to toothbrush. It may be mouthwash alone. So
right.
gradually, as the mouth starts to heal a little bit, if you're able to get back to brushing, even just gently,
Okay,
is a
then
way of
let's
just
talk about mouthwash. I mean,
mm,
in the United States, I use Act, of course,
okay.
alcohol free. I don't use mouthwash with alcohol. Alcohol should really not be touching any of your oral tissue.
Mouthwashes do they do vary a lot. Absolutely, alcohol free, it's the way ahead. Some patients, especially during treatment, can't cope with mint, so mouthwash may or may not be possible. Mouthwashes during treatment, such as Difflam, so that's a one that can actually numb the mouth. So if you're about to eat and you find it difficult to eat, it may just give you that little bit of anesthesia just so that you
Mhm.
can eat and swallow. Other mouthwashes, depending on fluoride content, because fluoride I think is really important. And mouthwashes ideally should be used at a different time of day, not after brushing, because again, there's less fluoride in a mouthwash. So I think the highest percentage of fluoride in a mouthwash in the UK that we have, that Colgate produces, about 500 parts per million. Most of them are far less than that. So if you think most toothpastes are 1,000 parts per million up to your high fluoride toothpaste, which is 5,000 parts per million, you don't want to be using your fluoride mouthwash after that toothpaste. So if you find a mouthwash that has got enzymes in, it's really gentle on the tissues, lovely. It just is all about what suits you.
One of the products that I really like, it's called Closes, and what it does is it balances the pH in your mouth. And when
Mm.
you're feeling like your mouth hurts a little bit, I find that that product really helps. And for everybody who's listening, when you mouthwash, I think it's important, and Josh, let me know what you think, is to gargle, because gargling is actually a really good exercise. Even if you just you rinse with water, gargle, because it exercises everything here at the back of the throat.
Absolutely. I mean, whatever works, whatever helps. That's not a recommendation I've heard or not heard about. So I think that would be
It's an
lovely.
Eva recommendation.
That's good enough for
I mean,
me.
yes, it's all about exercise. Once you've been through radiation, everything feels stiff. And
Mm.
I find that not only gargling helps, but also massaging all of this. When you're in the shower, massage your jawline like this. Get in there. I use a gua sha stone sometimes to massage down my neck too.
Is that the one with the jade roller on it?
Yes, yes.
Yeah.
Well,
So,
actually, it's a jade stone and it has a shape, a rounded shape. So it fits right like
oh, I know.
here and here.
Lovely.
It's really nice. And Karen, you asked about the water flossers, that some of them don't actually get to a low enough setting. And I agree
Yeah.
with you, some don't.
Yeah, they can
So
be very harsh. That's the
yeah.
comment that often comes back, that it's not possible, even way past treatment. So I agree. Absolutely, Karen.
Well, you know what, Benjamin, you may not be able to gargle now, but don't give up. It's a skill that you relearn, just like swallowing after being on a feeding tube. My life, I used to not produce saliva at all after
Mm.
radiation. And over the years, I have been producing saliva on the one side that wasn't, maximally radiated. So there is hope for everybody that things will improve. But don't give up on continuing to give love to this whole area. Be kind to yourself and give it attention, right, Joss? It's all about giving your mouth
Absolutely.
attention.
Absolutely. And it's about the new normal. It's really difficult at the beginning. People want to go back to how they were before. And some people do. They're able to go straight back to the spicy foods and things like that. And I'm always like, crikey, but a lot of patients aren't, and it's getting used to maybe different foods that maybe you didn't like before and now you prefer. So some patients don't like potato. They don't like chicken because it gets very claggy in the mouth. Some patients, if they like chocolate, it's got to be really high cocoa content of chocolate. It's different kinds of alcohol. Some people might prefer Prosecco. They might prefer because of the bubbles, or they may not be able to drink anything like that ever again. And it's a really hard thing to come to terms with for many, many patients, and it affects their living day to day, eating with their loved ones,
Right.
socializing. They
And
look
I
at
always say go
menus.
through it with curiosity, because if
Yeah.
you are curious about what you can eat and what you can't eat, the
Mm.
curiosity sort of kills the negativity that builds up. You keep saying, I can't do this, I can't do that.
Mm.
But instead, be curious, more curious about other things you could try to fill the gap. So, curiosity is one of my favorite words to use to overcome and cope. So, Benjamin, I see that you lost 80% of your tongue. I would be curious to know how much you taste. I have met people who can taste with other areas of their mouth. The tongue isn't the only organ that has taste buds. There are taste
Mm.
buds on some of the tissue in the back of the mouth and even the cheeks. And a friend of mine who had lost his entire tongue uses a coffee stirrer with like a round tip at the end, and he shovels the food back and forth to chew it. And
Mm.
he has created a very comfortable way for himself to live and eat socially. So just don't give up, Benjamin. And if you want to reach out for some ideas, don't hesitate to ask the Mouse Cancer Foundation or any of us on the call.
Eva, Sarah's got a hand up.
Oh, somebody has a hand up.
Yes. Hello, Eva. Hiya.
Hi,
Hi,
Sarah.
Sarah.
Hello, Joss. How are you?
I'm fine, thank you. How are you?
I just wanted to add, just to saying about the brushes, some other alternative brushes. The Oranus, they've got a really soft toothbrush, and also it's got a very small head,
Uh-huh.
which is a lovely brush to use. And also the Orally 360 brush, the children's one, is nice and
Yeah.
soft, especially if you are bringing up a lot of secretions. It allows you to be able to clean your mouth, but also clean your teeth as well at the same time. So it's kind of a bit like a 3-in-1 toothbrush, a bit like the Collier's Curve as well.
That is an excellent
Absolutely.
suggestion for all those
Yeah,
people
they're
that
really
visit
good
and they,
brushes.
right, and they can't open their mouths wide.
Yeah,
Yeah,
Okay,
I
so
really like the
any,
Orally 360. Great
yeah,
brush.
I do. And I think
can you share with us? Oh, I'm sorry, Sarah.
no, that's
Sorry.
okay, Eva. It's also quite nice for patients who've also had radiotherapy as well, because you might find, and also possibly if you've had trismus as well, you might find your mouth opening is going
Mm.
to be a lot more limited. So something with a very small head, like a 360 brush or even the Oronose brush, is a
Mm.
really nice adaptive brush to use, especially sort of during treatment when you are having that radiotherapy, because oral hygiene, as Joss is saying as well, even if it's just cleaning a couple of teeth, you're just kind of trying to maintain your oral hygiene as best as you can. And it's also being aware that you may not brush your teeth twice a day as you would normally. You may find you're brushing your teeth throughout the day and brushing your teeth in sections as well. It's doing what you're able to do at the time.
Okay, so
Absolutely.
Laura, you're absolutely right. I use my water flosser in the shower. It's cordless and waterproof, and I love that. The water just goes into the shower. I also sometimes floss while I'm in the shower because I just find like I can spend longer flossing.
That's
Joss,
you.
could
Perfect.
you share with us any success stories that you've had to inspire us?
So, one of my patients I treated when I was in hospital, he had no tongue. And when I first saw him, I said, the worst thing you could say. How are you? I never say that ever again. And I saw him for 2 or 3 visits after that, and then discharged him because his TPing, his cleaning between his teeth, was amazing. His oral hygiene was absolutely top notch. So it gave him that little bit of confidence, I hope, and pray that, you know, long term, that that's actually going to reduce his risk for tooth decay. And yeah, that really, he changed his whole aura changed with each visit, which was
Well,
good.
I think that is the best message that we can leave everybody with, is that you want to keep your own teeth. I mean, once you start losing teeth, and I have lost 2 teeth on the only side of my mouth where I chew, and I've had dental implants. Well, let me tell you, it is, I mean, over time, over the years, the gum has receded. It's not easy. It's better to keep your own teeth. So for all of you who are just starting on this journey, spend an extra 15 minutes a day on your teeth. Try to brush and floss and whatever after every meal. And that really keeps your teeth at an ideal place. One tidbit, Joss, is that I would say to people is that after you drink coffee or you have a peach or something acidic, you want to wait 30 minutes before doing your brush routine, because that acid actually eats away at the enamel, and then it softens it, and then you brush it away. So it's one thing you never want to do. But in general, our mouths tend to be acidic, aren't they, Joss?
So depending on how your pH is through the day, it can be acidic, it might be alkaline. The more that people are able to use a little bit of fluoride, if they don't get on with mint or with a surfactant, a frothing agent that's put in toothpaste, then there are other options with enzyme with a small amount of fluoride in, but it's also got calcium phosphate in, which is what's in your saliva that helps reharden your teeth. So there are other products that are available. So gold standard in the UK is to have high fluoride toothpaste, use it 3 times a day, brush, spit, don't rinse. But if people aren't able to cope with that because they're not able to cope with, like I say, the mint or the frothing agent, then there are other options. But please reach out to the Mouth Cancer Foundation. Lots of dental professionals that are very happy to help, because access to dental care is not great in the UK at the moment. And for head and neck cancer patients, I think that's not great. So we need to help
That's here
keep
in the
the
United
teeth.
States as well. Listen, Joss, I wish that we had more of you in the world, more people who could really specialize in treating people with oral cancer. And unfortunately, we don't have that. And it's hard to find. How do patients find a really great hygienist?
So I would say first thing is, if you can, contact the Mouth Cancer Foundation, get onto the Facebook group, get into that private group, because there's lots of support there for all international. So if somebody is in your area or your country, they're able to hopefully point you into the right direction for a hygienist that's able to see you or to give you advice that's appropriate to your local area. Get in touch with the Mouth Cancer Foundation. We will certainly help, you know.
Those are great suggestions. Reach out to people in your area to find out who they recommend. And mostly you have to advocate for yourself. If something's not right,
100%.
you got to ask, you got to get in there. Don't just accept an answer that doesn't feel right. Right?
Absolutely, 100%. Even more nowadays, I think, than ever. So yeah, absolutely ever. I agree. Advocate for yourself.
Okay. Thank you, everybody, for joining Mouth Matters today, our 3rd episode. And do not miss every episode after this. It's in 1 month from today on a Monday. Look on the website for more information. Goodbye,
Thank
everybody.
you.
Have a really good night.
Thank you.
Thank
Bye,
you.
Joss.
Bye.